The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Welcome to Wonderfully Made. I'm Dr. David DeRose, president of Compass Health Incorporated. Today we're going to be looking at a subject that is really grabbing lots of headlines, but perhaps not in the way that you think they are. We're going to be speaking about a subject looking at natural remedies and the challenges in natural remedies research. To aid me in this very important topic, as well as giving you some practical insights that will help you at home, is Dr. John Clark. Dr. Clark, it's wonderful to have you with us on today's edition of Wonderfully Made.
Thanks for having me.
You know, John, we in the medical profession are always hearing about the latest studies. There are all kinds of continuing medical education classes that are trying to make sure patients have cutting-edge information and that they're applying it in their practice. The mantra, if you will, in medical circles today is evidence-based.
Yes.
What does that conjure up in your mind as a physician?
Well, when you're talking about evidence, it sounds like a court case. And in fact, that's where it ends up a lot of times, is are you following exactly what the letter of the medical literature says?
Now, this is a fascinating topic. And for those of you tuning in today, there are study after study coming out, putting out conclusions that really raise concerns about the way doctors are practicing. I've got some of them with me today sitting on my desk, talking about whether physicians are complying with current guidelines. Here's one from the Mayo Clinic Proceedings: patients' understanding and compliance with medications. Medical professionals, as they look at the landscape of American medicine, are very concerned that doctors and patients are not complying. They're not following the best evidence in what they're doing. Dr. Clark, you've been treating patients over the years. You're doing a lot with patient education. Are you worried that patients are not complying with evidence-based medicine?
Well, I certainly worry when they don't comply with what I tell them.
Well, hopefully you're giving them what you think is the best information, right?
That's right.
And you really worry about that?
Oh, yeah. You know, you tell them what to do, and they do half of it, and they get half a result, or they're half sicker.
So when these expert bodies come out with a proclamation, let's say, let's take an example, some new medication that's out there.
Yes.
The word comes out that they've done these randomized, controlled, double-blinded studies. You know, the highest standard of medical research has been brought to bear, and this new drug is going to help with a certain problem. And so the experts say every patient with this condition should be on this medication. You see things like that coming across your desk.
Oh, yeah.
So does that mean that you as a physician then really are not doing your job unless you prescribe that medication for every patient with that condition?
Possibly, and then of course you have the advertisements that tell the patients about this information on their TV screens, and they come in already having filled out their shopping lists, and they know what they want.
No, you're exactly right. There's a lot of demand for medication, and part of that demand is being fueled by advertising practices.
Yes.
So what the challenge is for us today, I mean, we're talking about natural remedies, and you and I both over the years have worked with some simple approaches to dealing with disease. We've seen, God bless, those simple treatments, and yet many times we don't have huge double-blinded placebo-controlled trials. After all, how can you do a placebo-controlled trial with hydrotherapy? What kind of placebo is going to be the substitute for putting a hot pack on someone's chest? They're not going to know about it. Have you figured that one out?
Well, it's kind of difficult. I've seen some studies where they came up with some interesting placebos, but even the placebo could have some interesting effects.
Well, the bottom line in a real placebo-controlled trial is that someone is going to think that the treatment and the placebo are identical. And if I'm sticking a hot pack on your chest, you're not going to walk out of the study and say, well, I'm not really sure whether I got the hot pack or whether I got something that had no heat in it.
That's right.
So in a certain respect, the playing field is not completely level.
Right.
Because with many of these natural remedies, especially the physical modalities, the hydrotherapy, you can't really do a true double-blinded study.
True, yes.
Tell me, as an orthopedic surgeon, I know that's what your primary specialty is, whether you've seen hydrotherapy provide benefits to your patients.
Oh, definitely. You bet. And I've often instructed patients to do hydrotherapy at home.
Give us a practical example. So someone listening today, we don't want just to hear philosophy. We want them to say, well, you know, these guys talked about some philosophy, but they gave me some practical pointers. What can you do with hydrotherapy in the orthopedic realm?
Oh, well, for example, I sprained my ankle. I'll use myself as an example. And what happened is I was moving some furniture. I twisted my ankle. I thought I had broken it. I was sure that I was going to be in a cast. And
so an orthopedic surgeon misdiagnosed himself, in other words.
Yes. I was thinking, okay, this is going to be funny. Maybe I'll have to put on my own cast, and what am I going to do? And I was crawling around the house. I couldn't put weight on it. And so I started in on some hydrotherapy. My hydrotherapy, well, I put my foot in a bucket of hot water for 3 minutes, hot as I could stand. And then I put it in a bucket of ice-cold water. And it was winter, so there was ice-cold water coming out of my faucet, practically. And that was 1 minute. I went back to hot for 3, back to cold for 1, the alternating hot and cold 3 times.
Okay, so 3 cycles, 3 applications of hot, 3 applications of cold.
That's right. And then I ended with cold, put on a stocking, and let it rest for about a half hour. A day or two of doing that 3 times a day, and it was doing so well, I was walking around the house, and I'd forgotten about it, and I twisted it again, sad to say. Well, I went back to my hydrotherapy again, and within a couple days, I was fine. So I didn't have the embarrassment of walking around my office, or crutch walking around my office, explaining to patients that I was one of them.
Now, let me ask you this. The conventional wisdom, though, John, with acute injuries is just use ice, just use cold. Isn't that what we've been told? Why were you using this alternating hot and cold?
Yeah, I'm glad you bring that up. And if my ankle had been purple and 3 times its normal size, I would have used just ice.
Okay.
But it was sore, it was hurt, but it wasn't swollen badly, and it certainly wasn't bruised or purple. And so just using the cold would have worked too, but the hot and cold stimulates faster healing. It tends to, when you put on the hot, it brings more blood into the area. When you put on the cold on the surface, it tends to drive the blood deep. When you go back and forth, those vessels opening and closing tend to pump the tissues so that it gets edema or swelling out of the ankle. And it also increases the white count in the system, and white cells are involved in healing as well. So it works very well.
So there's no question in your mind that that treatment was efficacious in dealing with your sprained ankle?
Correct, yes.
And you've applied that counsel, you've given that prescription to many of your patients with similar injuries?
Yes,
and
I have.
Have they had good results as well?
Oh, yeah, very good results, and oftentimes we're able to avoid using poisonous drugs or having to go on for more surgery or physical therapy.
Now, I'm going to ask you this question, John, because I haven't seen it. I haven't seen out there in the literature where there's a study of alternating hot and cold therapy, at least done recently. Is there data out there like this, or is it just something that we've experienced, makes sense as far as the mechanisms, and we use it with efficacy?
No, I haven't seen a lot of studies on it. I do know there was a physical therapy unit that did a little bit of research into it, and they claimed they couldn't find anything in the current literature. Although we're a bit limited in that our current literature that will show up on a computer is just in the last 40 years. We've basically lost everything prior to that, and that's when they would have been doing more research on hydrotherapy.
No, I mean, this is a fascinating topic, because as we speak about natural remedies, the culture of America, at least for many years, was really set against natural remedies. All of the funding for research was largely coming from powerful commercial interests. And, you know, need we say, we could identify certain sectors of the commercial landscape in America or the world, but it's not just the drug companies.
Right. You know, we could write a grant for the water company to fund us for hydrotherapy, but I have a feeling they don't have quite the financial backing of the drug companies.
Yeah, but when you talk about diet things, okay, there are vested interests in certain segments of the dietary realm, and it's usually the people with the most money are not the fruit and vegetable growers.
Right.
So there are these powerful commercial interests that are influencing which research is done,
Yes.
what research is funded.
Right.
And so as a result, the landscape, when we look at evidence-based medicine, is largely shaped by these interests, or it's the medical device manufacturers.
Yes, exactly.
Now, you told me an interesting story once about this whole subject of evidence-based medicine and how even back in medical school you were given an assignment where you had to look into this.
Yeah.
Tell us what you learned.
Yeah, one of my assignments was to do a little talk on evidence-based medicine. And the idea being that I would come out with this discussion of how everybody needed to follow the literature perfectly or be a bad doctor. So I went and looked into the biostatistics behind evidence-based medicine. And there was a group who had gone through the literature, looked at something like 14,000 articles, and discovered that 40% of them didn't know what they were doing on biostatistics.
So these were statisticians that were looking over the shoulders of the medical researchers.
That's
presumably.
right. Yes, statisticians out of Boston. And so the evidence was against the evidence-based medicine. What's more, they discovered that if a research group had negative results, the results didn't necessarily support their hypothesis. Even though those results, if published, would help guide medicine, they never published it. And so that's a large majority of literature that never makes it to the printed page.
Yeah, so we talk about the so-called publication bias.
Yes.
And so if someone's studying a drug, if the drug shows no benefit, they're not likely to actually publish that data.
Right.
But if the drug shows benefit in a particular study, that'll hit the press.
Yes.
What a lot of lay people don't realize is that statistics is not an all or none phenomenon. In medical circles, we say if there's a 1 in 20 chance or less of something just occurring by the flip of a coin, then this is statistically significant. That's usually the criteria that we use in medical research studies. So John, let's paint a scenario here. Now, we're being a bit cynical here just to make our point.
Yeah.
But let's say I come out with a new drug, and it's a drug to treat heart disease patients after having a heart attack.
Yes.
And I say this is a $1 million market, $1 billion market, whatever. And so I do 50 studies. 47 of them show absolutely no benefit. Some show people get worse in those 47 studies. But out of those 50 studies, 3 show they get better. Now, if you use the standard rules of statistics, you would say, well, this doesn't look like anything. It's just by luck of the draw. But if I just publish those 3 studies,
Yeah.
it looks like there was an impressive finding.
Yeah.
Now, does that, I mean, again, this is really making something ridiculously extreme, but does things like this happen in the drug research literature?
Oh, yeah, you bet. Or, worse yet, they'll hire a university to produce good research, and they will set the parameters they're looking for as being specific to their drug, but they aren't parameters that anybody else would really be interested in. And then they'll find statistical significance on those parameters, which really don't tell you that the drug's going to help people.
Now, we don't want anyone tuning in today to think that we're saying there's never a place for medication, we would never recommend surgery. That's not the message that we're trying to give today. But the point that we're trying to communicate is many doctors today are being educated that there has to be solid evidence, huge studies, before we should use any approach as far as treatment. And what we're saying is once you take this step, you start excluding many of the most promising strategies that haven't undergone this, quote, rigorous approach, because it often takes millions or billions of dollars to research some of these things. So Dr. Clark, how can we intelligently then, in this framework, use natural therapies? I mean, people aren't out there necessarily studying these things in the detail that they are the latest drug or surgery.
Yeah, you know, that's a challenge for somebody. And one of the things about natural remedies is that it's gotten bogged down in a lot of commercialism also. And somebody was asking me the other day about this author and that book and that television show, and how would they know? And one of the things I told them was, well, if their research is trying to support their product they have for sale, you might want to look for somebody that researched it and had no bias or interest.
No, this is a very, very important concept. Much of what's being purported as far as good natural remedies research is just as blatantly commercial, or even more so, than what we're seeing coming out in the medical literature.
Yes.
And we don't want to give the impression that anything out there in the medical literature is skewed, that you can't depend on any of the studies. But what we're saying is it's not as cut and dried as sometimes doctors want to make it out to be. Even when a good study is done, you always have to ask, who was the group that was being studied? You know, Dr. Clark, let's say a study comes out saying that physicians who take acetaminophen, you know, Tylenol or some other anti-inflammatory drug, they take it every day, they live 10 years longer. Let's say it's a good study, and this population of physicians that was studied, you're a physician, right?
Yes.
So you being a physician, you see this data come out, you're going to immediately start taking Tylenol every day, right?
Well, actually, I would not.
Now, why is that? I mean, if the data is good, if it's good, clean science, why would you not do that?
I would question the data. Recently, there's been a number of articles coming out to show that drinking helps heart disease. Well, actually, you know, the bombs that hit Hiroshima helped heart disease. People died of something else. And sometimes you have to look and see if this research, you know, showing that people lived longer, they probably fed the acetaminophen or Tylenol to people they already suspected would live longer. You know, there's always a bias there to how they set up the study.